Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Zia. I welcome all of you from MMK Hub. It is the platform from where medical students can clear their concepts. We believe in conceptual and understandable medical teaching. Our topic of today is thyroid pathology. Thyroid pathology is actually a series of 4 lectures. In the first lecture, we will discuss the introduction and hypo and hyperthyroidism, and in the subsequent lecture we will discuss other aspects of the thyroid pathology. First of all, thyroid disease. What is thyroid gland? Thyroid gland is a gland present in front of the head and produces very important hormones that play a role in different systems throughout the body. Whenever there is deficiency of the thyroid hormone or there is excess of the thyroid hormone, the condition is called the thyroid disease. Similarly, thyroid disease can be hyperthyroidism, it can be hypothyroidism, it can be goiter, thyroiditis, and neoplasia. We will discuss these conditions briefly in the subsequent slides. Whenever body produces too much or too little thyroid hormone, the condition is called thyroid dysfunction, that the normal function of thyroid is now deranged. A person can be euthyroid. Euthyroid means normal thyroid, normal production of the thyroid hormone. A person can be a biochemically hypothyroid or hyperthyroid. In hypothyroid, there is a decrease in the amount of the thyroid hormone, and hyperthyroid, there is the increase in the amount of the thyroid hormone. अगर हम ये बात करें कि most common cause of the hypothyroidism क्या है, तो that is the Hashimoto's thyroiditis. And most common cause of the hyperthyroidism is Graves' disease. These are very important MCQs and Viva questions. Now briefly we will discuss the different thyroid disorders and then we will move to the hyperthyroidism and hypothyroidism. Disorders of the thyroid gland. First of all, goiter. Goiter is the swelling of the thyroid gland. A goiter can be a simple goiter. Simple means it's non-toxic. It's not deranging the production of the hormone. Simple goiter can be diffuse hyperplastic type. It can be a physiological condition due to the onset of puberty due to the pregnancy. Similarly, simple goiter can be a solitary nodular goiter in which there is a single nodule, or it can be a multinodular goiter. There are multiple nodules in the thyroid gland. And the toxic goiter, in toxic goiter, there is the excessive production of the thyroid hormone along with the increase in the size. And the examples are the Graves' disease, Plummer's disease or toxic adenoma, and multinodular goiter with toxicosis. इनको हम आगे briefly discuss करेंगे. Second disorder of the thyroid gland, second entity is the thyroiditis. Whenever there is the term itis at the end of a term, it means inflammatory process. In thyroiditis, there is the inflammatory process of the thyroid gland. That inflammatory process may be autoimmune inflammation. Examples are the Hashimoto's thyroiditis and chronic lymphocytic thyroiditis. Or it can be granulomatous thyroiditis, which is the detervenous thyroiditis. And the examples of the fibrosin type is the Rita's thyroiditis, and last is the suppurative thyroiditis. These we will discuss in detail in the lecture of the thyroiditis. Next disorder of the thyroid gland is the neoplasia. Neoplasia terminology हम normally use करते हैं any tumor, but neoplasia is not always cancerous condition. हर condition में neoplasia cancer नहीं होता. Neoplasia can be a benign. Benign means it's non-cancerous. ये cancer नहीं है लेकिन tumor है. And the second is the malignant. Malignant को फिर classify किया जाता है by the Dunhill classification into three categories. One is the differentiated thyroid neoplasia, which include papillary, most common papillary carcinoma, then is the follicular carcinoma. These percentages are the percentage of incidence, and then is the Hurther cell carcinoma. These we will discuss in the neoplasia section of our lectures. Then the undifferentiated category include the anaplastic carcinoma, medullary carcinoma, and malignant lymphoma. And malignant lymphoma in case of thyroid is usually non-Hodgkin variety, which is a B-cell lymphoma. Next category is the secondary tumors. Secondary tumor means primary tumor या original tumor किसी और organ का है. For example, tumor of the breast, colon, or any lateral spread from the surrounding structure. और वहां से ट्यूमर के डिपॉजिट मेटास्टेसिस के जरिए आगे थायराइड के अंदर उन्होंने हार्बर किया और वहां पे लॉन्च किया है. उसको फिर हम कहेंगे इट इज द सेकेंडरी थायराइड ट्यूमर. This is the flow chart which is summarizing these classification of the thyroid swelling which we discussed in the previous 4 or 5 slides.